In 2004, Dr. Manmohan Singh uttered, "We feel that we can cope up with the situation on our own and we will take their help if needed." Since then, India has not accepted any foreign policy aid. Despite this, our politicians continue to go abroad for their medical care. Ministers like Congress President Sonia Gandhi, Kerala CM Pinarayi Vijayan, Goa CM Manohar Parrikar are on and often moving out to different countries at the cost of taxpayers for their treatment. Their visit is questioning the potential of Indian doctors and the widespread infrastructure of medical facilities of India. Indian healthcare has come long way after post-independence. Number of hospitals are increased in every district and state. 1 lakh plus doctors are graduated and trained every year. Also, huge number of skilled nurses are molded. The ultimate truth behind this is the top leaders less trust our Indian medical associations and the upgraded medical facility infrastructure. Now it's evident that Kerala CM Pinarayi Vijayan, though aged, is not approaching for any major surgery or any bone replacements as he returns to homeland within a week. In the state of Kerala, where we have Trivandrum Medical College, Ernakulam Medical College and several others, which is well equipped with capable doctors who are competing to their best in their profession, along with appropriate prescriptions of medicines, they are unnoticed. To know the reason, we inquired with doctors abroad. They said, majority of efficient doctors are from India. Compared to them, Indian doctors perform more effectively. In Indian American Doctor Association and England Indian Doctor Association, more than 80,000 doctors are from India, and in American Medical University, 50 to 60% are Indians. The digits clearly picturize that it's India's mind, that is Indian minds mastering the profession. But it's our assumption that healthcare abroad is excellent. However, most experts would agree that the care one receives abroad is similar to that you get in a center of excellence in India. If we observe the cost of charges, the surgery costing $25,000 is $25,000 in US, which is 25 lakhs in Indian currency. The popular Mayo Clinic, which is spread throughout the metro cities of India and possess majority of Indian doctors, is doing their best to reach our doorstep for the care. The nurses from India, particularly Kerala, dominate the hospitals abroad. Apart from these, another significant development of India is the establishment of major pharmaceutical companies which supply the medicines across the globe. So, obviously, it is a question. The doctors, nurses, medicines are from India. Only the building is theirs. Why then the VIPs approach US for the treatment? India has been a medical tourism destination for over a decade, and as of now, a lot of people come to India every year for the medical treatment. Most of the people coming are generally from Asian and African countries. A small number of people also come from so-called bubble countries like US, UK and Australia. According to the data, around 6,97,453 foreign tourists came for medical treatment in India in the year 2019. We know the iconic Afghan girl Sharbat Gullah came to India for her treatment. Several patients have stepped into India for their medical issues, which also assures them that the cost stays within their package. When people across the globe flock into the Indian hospitals, the ministers distrust the potential of Indian doctors. Though Atal Bihari Vajpayee's knee operation was performed in Breach Candy Hospital in Mumbai, the doctor was called from US to conduct the surgery. This sparked the ability of existing doctors in the hospital. At the same time, Dr. Manmohan Singh's bypass surgery was conducted in AIIMS, Delhi. Gadkari, Sushma Swaraj and Jet Li all treated their medical issues in India. The high-profile ministers should recollect one thing. Although the exploitation of India at every possible level was unimaginable, the Britishers arguably left a decent healthcare delivery framework. We trust England, but the citizens of England trust Indian doctors for their well-being. The delegates, like Boris Johnson, has appointed Indian doctor as a personal physician. Joe Biden, US President, also chose an Indian doctor as his personal physician. Though it's one's personal choice to approach anywhere for the treatment, but it's less known why they move out for the small reasons. Yes, the best medical care for our leaders is our responsibility. They spend their active years in the service of our country. It is imperative that we take great care of them, but there is nothing better than getting excellent medical care in India itself, than traveling long distance and adjusting to new system to get a medical care.